quality is king. You must make sure that you're mastering the pattern before anything else. And there's a million different ways that you can master those patterns, but the three kind of functional things that I want every single person at the end of the day to walk away with if you are struggling with labral tears and impingement, the three movements that I believe that everyone in some way needs to master is Hey everybody, welcome back to the Unchoreographed Podcast. I'm your host, Dr. Jenna Lower. And in today's episode, we're going to be talking a little bit of a continuation from last week's episode. Last week, we talked about why there is no best exercise for hip impingement and labral tears. This week, we're going to be covering three common movement patterns that I do emphasize in hip impingement rehab and three movements that I think everybody should be able to master. Now, keep in mind that this isn't me saying you must do these exercises, because there's a lot of different ways to master these movements, and it may not just be the exercise itself. Really, these three patterns are functional movement patterns that everybody needs in their lower body, no matter what. And so what we want to do is take those patterns and help your hip move in a way that is healthy again, so that you're able to build strength and find the muscle control that you need. And just know that there's a lot of different ways that you can actually master these movements. So let's talk about kind of on a muscular standpoint with what happens with hip impingement and labral tears, because it doesn't necessarily mean just if you have these problems that there is inherently some weakness there. I think that's often the misconception, is that like, well, my glutes are weak, so I have impingement. And possibly that might be what it is, but what I find more often than not is that it's not always just a problem with weakness. It's a problem with muscle timing and coordination. So a lot of people have really good strength, but they don't quite understand how to use the right muscles at the right time to support and stabilize the joint. So they're moving in ways that are actually creating more stress and more compression on the joint. And that's ultimately what we are trying to reduce when we're doing conservative management for labral tears and impingement. We're trying to manage the amount of stress and pressure that's in the joint so that you can eventually become asymptomatic, like not have the symptoms anymore. And if you can effectively do that, that's how people can manage this without needing surgery. And it is very possible. But there are some common, patterns that we see with how somebody moves that has impingement or a labral tear. And these things too, they're not necessarily problems that that another therapist might realize. You have to understand, I've been doing this and specializing in this for a really long time now. It's been almost 14 years. And really in the past couple years, I have almost exclusively worked with people that have hip issues. And from doing that, I have seen these patterns between almost all of my clients. So it's not necessarily something that a physical therapist learns in a textbook in school that like, hey, if somebody has hip impingement, here's the problems that you're going to see. This is sort of what I have found as in the research that I've been doing over the past 14 years, and the patterns and the commonalities that I see between my clients. There are some really common patterns of problematic movement or dysfunctional movement. And I'm always cautious about using the word dysfunction, because I think sometimes it alludes to the fact that things are worse than they are. But really what I mean when I say that is that you're just not moving in a way that your hip likes very much. And so we can be more effective with those patterns and help reduce the pinching and the discomfort that you feel, or whatever symptom it is that you feel, so that it's not creating more problems. So a lot of that comes down to looking at what are the movement patterns that you are moving in, what are your imbalances, and making sure that you can coordinate the muscle control and timing so things are firing and controlling when they actually need to be, versus just saying, hey, here's this list of exercises, go do those things, right? Which is kind of what we talked about in last week's episode. So from these common movement patterns and problems that I see, there are also 3 functional patterns of movement that I want to make sure that when I am done with a client, whether they're working with me in the clinic or they're working with me virtually or in my self-paced program, there are 3 movements that I believe every person needs to be able to master, and master in a pain-free way, in order to get back to doing all the things that you like. So those 3 movements are a squat pattern, a hip hinge or basically a deadlift pattern, and single leg. So those are the 3 movements. Let's break down each one. So squatting pattern. Now again, does this necessarily mean that we jump straight into squatting? No, not necessarily, because that may not feel good to your body right now. In fact, that might actually make a lot of your symptoms worse. So don't necessarily go and just start doing a bunch of squats. We want to make sure that we are getting you towards the squat pattern, but doing it in a way that your body responds really well to. So the reason that that is so important is because we have to be able to squat every day, multiple times. If you think about every time you get up and down from a chair, it's a squat. Every time you get on and off the toilet, it's a squat. Every time you get in and out of the car, squat. Pick something up off the ground. Sometimes it's a squat, sometimes it's a deadlift. We do this a lot. You have to be able to do it a lot, which means if you can't master that movement and do it in a way that doesn't irritate your hip, you are going to have a really hard time progressing forward into other things that you want to be able to do. And you're also just going to have a hard time living day-to-day life because your symptoms are going to keep flaring every time you do that movement. Most of the time, it's repetitive stress on these things that will cause problems. So like if your hip, the front of your hip pinches every single time you squat, it may not be the one squat that does it and like puts you over the edge, but it's probably the repetition of how many times you actually do that motion throughout a day that creates a problem. So that being said, you have to make sure that you master it, because without it, your symptoms are going to continue. And I think a lot of times we don't always correlate in our brain like, oh, it's me getting up and down from a chair that's causing problems, because in the moment, it may feel fine. It may not be creating issues. Maybe it is, and so it's easy for you to connect that. But for a lot of people, it's not. It's hard to see that pattern. And maybe they even feel fine while they're doing, 10 reps well controlled during their exercises. But the difference is they're using good patterns and form during the 10 reps that they're prescribed as their exercises because they're so focused in on it. But when you're first learning that and you're not focused in on it, you go back to moving without thinking about it, and you probably start to go back into the wrong patterns. So now you go back to getting up and down from a chair or squatting to pick something up off the ground, and you're not thinking about it, and then it hurts again. And it's not because the squats aren't working, it's because your body hasn't learned that pattern yet. And this is why it's so important that you take these functional patterns and you actually learn how to move well so that it inserts into your functional daily life really well. So squatting is just one of those things we know you have to be able to do. We know you have to be able to do it in a symptom-free way to be able to get back to life and all the other things that you want to be able to do. Now, again, there's lots of different ways that you can go about it, because for many people, a squat itself is not going to feel good. So we have to look at you as the person. How do we customize that so that it works? Maybe it is just a rock back on the ground, which is basically getting you towards the bottom of the squat position, but you're not doing it against gravity. Maybe you're doing a sit to stand from a chair. So you're not actually squatting without something behind you, but you're just doing a sit to stand because it helps you hold your form. Maybe you're doing a box squat where you just touch your butt. Maybe you have to figure out how to fire your quads in a completely different way because it hurts when you fire your quads. So there's so many different ways that we can get you doing a squat pattern without doing the thing that reintroduces pain. For a lot of people, it's like they're fine when they're maybe even doing an air squat, but then we try to load it and then that creates problems. So we have to modify that squat in a way that doesn't reproduce the symptoms. And this is where working with somebody who's skilled at what they do is really important, because they are going to be able to actually teach you, how do I modify my squats so that it doesn't hurt, versus you saying, oh, every time I squat, it hurts, so I just can never squat again. Well, that is just not realistic, because you're going to have a really hard time in your day-to-day life, and you're probably going to be struggling with pain for a while unless you can learn how to master that. So find somebody who can help you get to the point where it isn't painful anymore. So the second pattern is hip hinging or deadlifts. So this is basically where we get the posterior chain of the body firing. This is your glutes, your hamstrings, your back, and it's getting those deeper glute muscles to engage. Now, why is a hinge so important? Because again, we do it all day long. Every time you go to bend over and pick something up off the ground, it's essentially a hinge. You've probably heard a million times, lift with your legs, not with your back. This is how you start to do that. So, and then the other thing is, we know that it's going to work and fire the muscles that many people with impingement and labral tears are struggling to find, which is the deep hip rotators and the glutes. So again, I think a lot of times in traditional physical therapy, it's just jump to like, well, we need to get your glutes stronger. Glutes, glutes, glutes. And that's great. But the problem that I see with most people who come in that are having issues with their hip are they actually are completely fine or they are doing deadlifts all the time, right? But, and maybe they don't even hurt. However, they're not actually using the correct muscles. They're not stabilizing from where they need to stabilize. So their external glutes, the big power muscles on the top, they get really strong. But the underneath, the stabilizers, the deeper glutes, the things that really control the movement at the joint that actually reduce the impingement and the pressure on the labral tear, they're not actually firing. So what happens for a lot of these people who are deadlifting is they either plateau, so they build up to a certain point and then they just can't lift any stronger, or they end up eventually having pain and getting hurt. And so it's really important that you understand, well, we have to get the stabilizers firing first, and then my big glute muscles on top of that can fire second. We need to make sure, because you can use the big glutes without the stabilizers, but it's pretty hard to use the stabilizers without the big glutes in a hip hinge pattern. So we have to make sure both of those things are happening. And I would argue this is for any pattern, right? Like this is the same for squat, maybe different muscles, but it's the same argument of like find the stabilizers, then make sure that the other bigger muscles that are actually moving the joint are working on top of that. This is what will help you get past that plateau of either building strength, pain, whatever it is. It will help you get past that. But that hip hinge, again, it's such a functional pattern that every human has to be able to do before we even start diving into like sport specific stuff or activity specific things. This is just a pattern every human needs to be able to understand. And so this is a really important one for hip impingement and labral tears. Last thing on this one, I'll say the other reason that this is really important, if you've heard about me talk about the anatomy of hip impingement and labral tears before, you've probably heard me say this, but part of the goal in the movement retraining that we do is to try to keep the head of the femur centered in the socket. So if you are moving into a hip flex position, so like if you're bending forward at the waist, the head of the femur actually needs to glide down and back a little bit into the socket. And if that doesn't happen, there's too much compression on the front part of the joint, and that's that classic pinch or catch that you will sometimes feel, or the pain, whatever your symptom is. It's because the head of that femur isn't gliding correctly in the socket and staying centered. So part of the reason that mastering a hinge becomes so important is because it helps you get into the pattern that helps the head of the femur glide down and back into that socket. It helps train keeping the head of the femur centered, which is exactly the pattern that we want, that a lot of people are missing. But you can do the hinge incorrectly and not actually be centering the head of the femur. So this again is why it's important to understand how to move and the pattern of how to move versus just the exercise. So I'm not saying go jump to doing deadlifts. Just like I said before, there's a progression that sometimes we have to walk through to make you be able to do a deadlift. But when all is said and done, and if you are quote unquote successful in your rehab and your recovery, you should be able to deadlift again without feeling symptoms or problems. And if you can't, then that may become a different discussion of like, well, what is happening here? Is it that you're not using the right patterns? Is it that the structure is not allowing you to get there? Are you somebody that maybe is a candidate for surgery? So, but at the end of the day, you should be able to master that movement no matter what. And then the last movement pattern is single leg. So this piece, this is something that generally will come after. So I'm not going to jump from doing a squat to like doing single leg because I need to make sure that somebody is comfortable, confident, moving with good patterns on 2 feet before we shift over to 1 foot. But again, single leg stuff is something that happens frequently in our day-to-day lives. It also depends on like what is your activity. So if you're a dancer, you're doing a lot of single leg. If you're a runner, well, running is always a single leg activity. So you better not be jumping back to a return to run program if you can't control a single leg movement. And the list goes on and on. So we have to make sure a single leg is incorporated at some point. We can't do everything on 2 feet. Now, what does that mean? And the reason, again, I don't say a specific exercise here, I just say single leg, because there's a lot of really good single leg exercises, but which one you do depends on what your goal is. So maybe you need your glutes to fire, and then we do something that's going to fire that up. Maybe it's glute med that we're going after. Maybe it's hip flexor, right? Like a million different ways that we can go about it. It just, you have to be able to in some way or another do single leg, and it should be relatively specific to the activity it is that you're trying to get back to. But why single leg is so important is because what it is, it's controlling the pelvis over the femur. So in a lot of the other exercises that we do, and it depends on, again, the exercise, but often we're working on moving the leg on a fixed pelvis. You also have to be able to do it the other way around. You have to be able to move your pelvis on a fixed leg. So your foot is planted on the ground. I have to be able to control my pelvic movement. Now, when I'm on 2 feet, that's a little easier because I'm not having to control for the one side of the pelvis. Like both my feet are on the ground, both sides are supported. When I take that other piece of support away and now I'm on one side, well, there's another whole half of my body that I now have to be able to control. And if I don't have the strength in that standing leg and I don't have the support there, then really I don't have the strength and the control that I need for day-to-day life. On top of if there is something like running you're trying to get back to. So we have to make sure that you have the strength to be able to control your body and your pelvis over that single limb. This is one, again, there's a lot of different ways that you can go about incorporating single leg. So I would tell you the most important thing versus what type of exercise you do is how you do it, making sure you're using good patterns, you understand what muscles are supposed to be firing, where the control is coming from, and your therapist should be able to walk you through exactly what that is. When they give you a single leg exercise, it should be understood. What am I trying to work here? What is my goal? What is my desired outcome from this? And if there is no rhyme or reason to why that exercise has been given to you or what it is for, it becomes really hard for you to stay motivated to keep doing it because you don't understand what the heck it's for. So make sure that you have that discussion with your therapist. If you're feeling unclear of like, hey, why did you give me these exercises? They should be able to explain to you exactly why it was given to you. And if there is no pattern or reason behind it, I would urge you to, maybe that's a different conversation that you have to have. You need to make sure that you're working with somebody who can give you the pattern and the strategy behind why you're doing what you're doing. I said it in last week's episode. You'll probably hear me say it a million times more. Random rehab equals random results. There has to be a strategy and a pattern behind why you're doing and what you're doing and why you're doing it. The other big takeaway that I want you to get from today is the quality of how you move is far more important than anything else. It's more important than what you do or how many of reps that you do or how much weight you're holding. Quality is king. You must make sure that you're mastering the pattern before anything else. And there's a million different ways that you can master those patterns, but the 3 kind of functional things that I want every single person at the end of the day to walk away with if you are struggling with labral tears and impingement, the 3 movements that I believe that everyone in some way needs to master is squat, hip hinging or deadlift, and single leg. So if you can hit all 3 of those things, you're generally going to be moving in the right direction as long as you're doing it with good form and you understand kind of the progression of how to do it in a way that works for your body. So hopefully that makes sense for you guys. I know that it is frustrating to sometimes not just say, hey, go do these exercises. But again, the reality is that there is no best exercise for this. It's how you do it. It needs to be the appropriate thing for your body and your symptoms and where you are at in your journey. So, and if you want more on that discussion, be sure to go back and listen to episode 11, because that's exactly what we talked about in that episode. If you guys have any questions, if you want to learn a little bit more about the pattern and the process that I use with my clients and the framework that gets people kind of unstuck out of this cycle of pain, I'm going to drop the link to my most recent webinar replay. I'll drop it in the show notes so you can go ahead and watch that video. And then, as always, let me know if you have any questions. Let's keep the conversation going in the comments. And I look forward to seeing you back here next week on Unchoreographed.